Ideas on the go, winter edition. As you can see, I have broken out my supersonic winter coat. Basically, it is like the equivalent of snow tires, but for my body. It's cold in New York, and it is dry. So, a few comments on some of the mistakes I've been seeing people make lately, despite our being in winter. Number one, please wear socks. Now, I personally am not a big lover of socks. If I could be barefoot without shoes even the whole year long, I would be thrilled. And normally, when you see me at work, I'm wearing clogs without socks. But this time of year, I am wearing socks. You do not want your bare skin exposed to these temperatures. Ideally, before you put your socks on, you're going to moisturize your feet and your shins and your ankles and all, because those are areas that can get dry and itchy quickly. Frankly, if you are someone who tends towards itch, take an antihistamine in the morning if you find that wearing socks makes you itchy. Although the moisturizer will help, the socks can still rub as you move. I'd recommend you wear socks that are thick enough and soft enough to not rub and to not irritate, and also thick enough to block the wind.
I really can't stay.
Baby, it's cold outside.
I've got to go away.
Oh, darling, it's cold outside.
Number two, not wearing gloves. Now, I am in my car, which is heated, and my car was inside a garage, so it's warm inside my car, so I am not wearing gloves right now. Again, the concept is you don't want that cold air on your skin. Now, most patients are telling me that they are finding that suddenly their skin is red or blotchy, or they've never had itch before and suddenly they're itchy. Well, even if you've never been itchy before in the winter or never gotten dry with the winter, remember, things change over time. First of all, as we age, we don't hold moisture in as well. Second, if you've switched and started using an anti-aging regimen that has a topical ascorbic acid, vitamin C, or retinol, or alpha hydroxy acid that you were tolerating fine in the summer and even into the early fall, at this point, it could make you irritated. Did you change where you live? You know, college kids going off to college suddenly are in dormitories, or do you have dry heat? Well, the basics to go through: one, make sure that on a daily basis you are using a gentle cleanser, replenishing cleanser. Personally, my fave, both for the feel of it and the science, is the Dove body wash, the regular or the foaming. Find something very gentle that you like.
This welcome has been
Lucky that you
so
dropped in.
nice and warm.
Look out that window at that storm.
My sister will be suspicious.
But your lips look
My
delicious.
brother will.
Even if you tolerated it before, this time of year you may not. Limit the length of time of your showers. I know when it's cold outside, it feels great to be in a hot shower, but limit that time, because the longer you're in the shower, more potential barrier breakdown. When you get out of that shower, pat dry and moisturize. Honestly, I take very little time to get ready in the morning, and even I can moisturize. And I moisturize, it takes seconds to moisturize the arms, the legs. I like using something that rubs in easily but provides a lot of moisture. The Trixera by Avane is excellent. For my body, I also like I love the Caudalie body butter. Find something that you like that rubs in well. Don't stop because the moisturizer you have you think is not rubbing in. And just like rubbing in sunscreen, rub it in straight motions. It will go a lot faster. Next, when you are sleeping, if you are someone who tends to get very dry, add a humidifier. If you don't have humidification in your heating system, then just adding it to your bedroom overnight can cut down on how dry you are in the morning. If you are moisturizing and humidifying and everything is going and you're still dry and flaky, Look at what else you're using on your skin. Cut back on anything drying, whether it's acne medicine or anti-aging, to every other night, every third night, and that's helpful also. Don't forget the power of petroleum jelly. Whether it's petroleum jelly or shea butter, very similar effects because they're occlusive. Vaseline, it's very bland, and it's great for all those super dry areas because it seals in. Don't worry about being addicted to lip balm or to Vaseline for your lips. Nobody gets addicted to it. The reason that the more you use, the more you seem to put on is often because you're using it a lot in times when you're dry. Every time you pick up your water bottle and drink, guess what? You're wetting your lips and then they're evaporating. They're going to be dry again. Just like washing the hands will dry the hands, drinking something, eating something wets the lips and then dries them out. So just like you should be using an excellent hand cream for your hands. Personally, I like what was called Dermatopics Intensive, now the Replenix, which has a large amount of glycerin.
My father will be pacing the floor.
Listen to that fireplace
So
roar.
really, I'd better scurry.
And then dimethicone to seal, and it feels silky, so then I can put it on and immediately touch stuff. For my hands, I'll often use it for my feet. Just as using that for the hands, you can use that for your lips, or you can use Vaseline or your lip balm of choice. If your lips are already cracked, then avoid things that might sting, like menthol. If you have been sneezing a lot and your nose is red and irritated, don't put alcohol on it thinking that, oh, it must be infected. Keep that moist also, because the little cracks are a good place to then get an infection coming from the respiratory tract or your skin around it. And if anything is just getting itchier or scalier or yellow crusted, please see your dermatologist, because it's possible you could have either a super infection, or it could just be that you need a potent topical steroid. Finally, don't drop the sunblock this time of year. I don't think dermatologists can say this enough. Ultraviolet A gets through, and it's such an easy thing, such an easy layer, and then you don't forget. I use my same Isdin Eriphotone Actinica or Elta UV Clear this time of year that I use the rest of the year.
I really can't stay.
Baby, don't hold
Oh,
on.
but it's cold outside.
I just put it on over my extra moisturizer, which right now is the same Trixera Avane, but if it gets drier, I will bump it up to my Caudalie Premier Crew, which also has resveratrol and other antioxidants and peptides, and actually is somewhat anti-inflammatory because of that. So that's the story. That's my avoidance of winter mistakes, keeping your skin smooth, comfortable, and not itchy. And going back to that first one, people, wear your socks. That's Ideas on the Go, winter.
Baby, it's bad out there.
Say, what's in this drink?
No cabs to be had out there.
I wish I knew
The
how
eyes are like starlight
to
now.
break the spell.
I'll take your hat, your hair looks swell.